approaches can be collected together, there's a tendency for a massage therapist to overstep. And the worst thing you could do, even just for the patient, is to drive a sense of a doubt in the other therapy that they're receiving. If I say somebody's PT is doing something wrong, I'm immediately wrong. They have a better, I don't care who they are, you got to know a little bit your place in the continuum. And the biggest thing I tell you is don't create doubt in people. If what they're doing works for them, let them keep doing it.
You know, and if you're in an integrated system, this goes for the spa environment too. You know, you are not estheticians. You know, if somebody says, what do you think that is? You say, here's what I've been trained to look for. We do have an esthetician on staff that might be able to give you better information, or a dermatologist might be called for. So, and scope of practice for massage is huge. We can stretch, and we can cut, and we can scrape, and we can put vibration things on people, and we can pound on them, and it's huge. We can dunk them in water, and who's coming?
Just me. Oh, there he is.
Hi.
You want to give Grandma a hug? Go ahead. Quick, quick, quick.
Oh, my baby, I'm so happy to see you. This is Grandma's class.
Yeah, you got your mask in it?
Yeah.
You're doing a great job with it, too.
Yes, I know. Come on.
Where's Lucas?
Not here.
Oh,
I'm not home with them.
no, he's home with Daddy? Well, aren't you special that you got to come to Grandma's school? There's no such thing as pediatric massage either. There's just little people. Okay, so if I am in an integrated environment and somebody else that's more highly credentialed than I am can do a method, i.e. scraping, cupping, stretching, deep releases, joint manipulation, then they should do it. Not me.
And a key thing too is just to make sure you have these professional conversations, like one-on-one. Don't come over, I mean, this is a rare dynamic, but one of the worst things anybody could do is, let's say a PT's working with a client on the table and you come over and start questioning them and asking what they're doing. Ask that question after they're done, when you guys can be alone. Does that make sense at all? You know, have these conversations one-on-one so you can better understand where their mindset and approach is coming from. Don't do it while the client's in the room, ever.
Yeah, and the other thing is that once you build a relationship with them, then they may feel comfortable with you doing some of this stuff. But it should be them telling you. This goes for all integrated care. I don't care what it is. If you're working with other professionals and you both can do something, defer to the one where it is the specialization for them and they are higher, have a higher training. So, massage can do a lot of skin scrubs and all that kind of stuff. But as soon as you say this is going to help your skin, you have now breached scope of practice for the esthetician. You know, so those types of things should be referred to your esthetician. Doesn't mean you can't. We smear some stuff on people and we wipe it off and stuff. I mean, we do some of that. But it's not about treating skin. Okay. Research update, real quick. Most of the stuff that we thought we did, we don't.
Okay.
All right, we don't detox. Posture, ideal posture, and all that kind of stuff probably doesn't matter. Still gonna teach you a visual assessment and all of that, but it's not likely to make any difference. People adapt pretty resourcefully. Pain is not, other than acute pain, is not in the tissue structure itself. It is a habituation, or the brain has a habit of pain. Specific work doesn't make that better. General massage and increased movement with a decrease in fear is what makes that better. So you're here for a class on deep releases, and I just told you they don't make any difference. So, there are some nuances on that, especially when you can recreate the person's symptom. Then they know you know.
And it can be, in the context of a general full body massage, sometimes people need focus in some areas at some times versus others. There may be additional compensation regarding a past injury, recent, let's say it was an acute ankle sprain. It initially, that first month you can't do a whole lot, but let's say it was a chronic one, or it had happened a year ago and it had offset their gait. There may be a reason to pay attention to the ankle for a little while and to think deep release initially, but really we're thinking more still full body. What is maybe some of these deeper structures that haven't been addressed in what is sometimes just a general full body massage? And the other thing that she indicated was it's the idea of maybe creating a new definition associated with people's pain perception. What's their relationship to it? One of the easiest things that helps people feel less pain is sleeping better and breathing better, because it's a down regulation of the nervous system. It takes your nervous system to a place where it's not as worried about stuff. It's not as vigilant. So helping people's pain perception, as opposed to thinking you're going to fix or cure a thing, it's helping them perceive it and feel it maybe in a different way.
And helping them understand that they're not going to hurt it by moving it. So now, sometimes they will hurt it if they move it, but that individual should be referred. A person who I can't even say it for joint replacement anymore. They got you up moving those things within 5 hours. But a joint replacement hasn't got the same movement that your own joint did. So if you want them to flex their knee, it's a knee joint that was replaced, you don't move it. You tell them to move it, because they know how it's supposed to move and not move. You don't make something do something that it inherently doesn't want to do. Now, tons of research has continued to show that pressure, the perceived squash, is important. That superficial, real light work does not interface with all of the same relaxation neuroendocrine responses. There's something about the pressure that makes a difference. But it's the pressure, not the pain, that makes a difference. It's the pressure. So we got to learn how to do that. We have to learn how to explain these things to the client so they can start to make the transition in their head over the misinformation that they have had. We do need to deal with COVID and what that is going to mean, because it's not going away, and it is a respiratory thing. And so breathing becomes an issue. And the way these 3 days are going to lay out is we're going to do lower limb as the focus, then upper limb, and then torso. And when we get to the torso part of this, then we're going to take a look at the breathing and how that works into that. Everything is assessment, And we're looking for what's working well, not what's wrong. So, when you do your general massage and you do some joint movement, you go, wow, that moves good, because it did. Oh, that tissue slides nice, because it did. How many times do we do that? Instead, the focus seems to be, that's a little stiff there. We need to work on that. You got a spot. We need to work on that. Come on, fess it up. All right, so let's change it up. This works good. This is doing good. This feels good. This spot right here maybe could use a little bit of help. Start telling people about how they are doing good instead of always focusing on what's wrong. This is something called the model of salutogenesis instead of pathogenesis. Salutogenesis is what's working well in a movement to health and wellness. Pathogenesis is what is wrong and can we fix what's wrong. The medical model is pathogenic. The wellness healthcare model is salutogenic. We can cross the bridge and work in a medical environment. But chances are in a hospital or something like that, you're going to be doing very general palliative-based care because you're working with people that are acute. Because the medical system doesn't keep chronic anymore unless you're in long-term care. And at that point, that's still comfort care. So you don't do any of these releases in those environments. Aren't you glad you took this class?
But that awareness of wellness maintenance is so important. However, it's not sometimes as interesting or focused on because how do I prove what I prevented? How do I prove what I prevented? In the sports world, that was a big thing. How can we decrease the tendency to get an ankle sprain or a knee tendonitis or a hip bursitis or anything like that? You can't prove that, but you have to constantly be thinking more from this framework. What feels right, and then compare. It's a wonderful tool to just compare and contrast. What are the parts of the body that are working well? Keep them moving well. And then you use that comparison to give you a better reference for what isn't. So simplest thing, working around an area before, working around the symptom before you go right after it. Comparing one side to the other. Well,
Yeah, so which side? Usually when people come in and they got a thing, it's on one side. All right, so you go palpate the other side or move the other side. That's your normal.
I'd say something profound to wrap up the close to the hour segment. Profundity.
Yeah, something profound.
There, perfect. Well, we
Okay.
return on the next segment.